in the early days of breastfeeding, your baby's stomach is so small. But again, their sucking is reflexive. So like I said, if you put that really fast disposable nipple on a 3-ounce bottle, they might suck that whole thing down. And it's not because they need it, it's because it's reflexive. And then they actually might spit it up because their stomach's really just not big enough to handle that.
Hello, and welcome back to another episode of the Birth Lounge podcast. You guys, every single week I get to hang out with you, and I'm so excited. Now, before we dive into the episode, I wanted to share an email that I got last week. It was from someone who has been using the Birth Lounge app, and here's what she wrote. Hi, HeHe. Last week when I went to my 39-week appointment, my doctor really pressured me to put an induction on the calendar, citing that my pregnancy was likely not going to get started without medical intervention. He also said, without following it with any evidence, that he rarely sees moms go into labor these days, and he thinks that it's just the stress level that women are under. Thankfully, through all of the education that you provide within the Birth Lounge app, I knew that I didn't want an induction. So I kindly explained to him that I didn't feel comfortable with that and that I preferred to wait for spontaneous labor. He then proceeded to tell me that he didn't want my placenta to stop working and that he really urged me to get an induction on the calendar. Sitting right there in the office, I pulled up the article about calcification of the placenta and going past your due date, and we had further discussion. He really stuck to his guns about encouraging me to schedule a 39-week induction, and I held strong in my opinion that I wanted to wait for spontaneous labor. I thought I had made myself clear, but when I got to the checkout desk, the front desk lady asked me if I was aware of the orders to put in a 39-week induction and asked me what date I wanted to come in to have my baby. Because of the Birth Lounge app, I was able to confidently decline this even though she continued to pressure me. I used your line that I found in the scripts for Advocacy to say that they were welcome to put a date on the calendar, but that I wasn't going to come and I really preferred to wait for spontaneous labor. Although she was a little stunned at my hesitancy to get a 39-week induction on the calendar, she did allow me to leave without making an appointment. I'm so glad I had the data inside the Birth Lounge app to help me feel confident in this decision. Otherwise, I can see how easy it is to be pressured into things that you don't want, and I might not have known otherwise. Oh my gosh, this makes me so happy. I love hearing you guys take control of the decisions that are made in your pregnancy and birth. I'm so sorry that you kind of had to face all of these roadblocks, or might I say road bumps. They weren't really blocks, but I can definitely hear how your hospital staff or your clinic staff really badgered you into trying to convince you to get a 39-week induction on the calendar. Also inside the Birth Lounge app, you will find information on induction and C-sections and how those two things are connected. Plus, those scripts for Advocacy that you mentioned, not only is that one of our number one downloads, but it's also one of my favorite tools to keep in your back pocket, aka the app in your back pocket, to keep you in control of the decisions that are made and helping you navigate these conversations when they feel a little sticky. You know, if you follow me on Instagram, that I always encourage you to have collaborative discussion, one that is based in respect, but also holding firm to your boundaries if you feel confident in those. The Birth Lounge app is not meant to be your childbirth education. That's what the Birth Lounge membership is for. However, the way that this mama used the Birth Lounge app is absolutely perfection. Pull it up in your OB's office, sitting right there on the exam table to show them the data and the science that back up the choices that you are making. The other way I love to use it, well, there's actually two. When you're sitting in the lobby waiting for your prenatal appointment, go in and find the week gestation that you are currently at. And not only will it tell you what's going on in your body and the development that your baby is at, but also it will tell you the questions about the hottest topics that are on your mind that you can ask your provider to do exactly what I talked about before, having that collaborative discussion. And the second way is when you feel like scrolling social media that, typically kind of gives us anxiety, I recommend that you scroll the Birth Lounge. Instead of scrolling to numb your mind, scroll to empower yourself, scroll to expand your brain power, scroll to get smarter so that you can have a better birth. Download the Birth Lounge app by heading to your respective app store, whether you're Android or iPhone. Type in the Birth Lounge app and download it today. I can't wait to see you there. Bye.
Hey, y'all, and welcome back to another episode of the Birth Launch Podcast. Today, I have my friend Brit Patos, who is the founder of Infant Feeding Care, on with me. And we're going to be diving into all the things you need to know about choosing a bottle. A lot of parents just think that you just choose one, or whatever your neighbor or your sister or your best friend use is also going to be appropriate for your baby. And that, unfortunately, is just not the truth. There's a lot of things that we want to be considering when it comes to bottle mechanics: the nipple size, the nipple flow, the nipple shape, even how the bottle interacts with the flow of all of that. So, Britt, before we get started, welcome to the show.
Thank you. Thanks for having me.
Absolutely. I'm really excited to dive into all this because I think, again, a lot of people think that choosing a bottle is super simple and that it really doesn't impact too much on your feeding journey, but that's not true. Can you start us off with why we need to be very intentional with choosing bottles?
Yeah, I think you're right that oftentimes people choose whatever, their friends gave them or whatever somebody recommended, and for a lot of babies, that can be really fine. There are a lot of babies who will eat from whatever bottle you put in their mouth and they will be fine. But there are also a lot of babies where we really need to be thoughtful about the bottles that we're choosing when we're doing bottle feeding. And also, I think for families who are trying to do a combination of breastfeeding and bottle feeding, that's also a scenario where we need to be thoughtful about the flow rate in particular. Um, Manufacturers make bottles in all sorts of crazy shapes and sizes. And, there's really been a push in the last several years to make bottles that look like the breast. And the reality is that they don't act like the breast in a baby's mouth. So, I think they're for families who are doing a combination of breastfeeding and bottle feeding, having a nipple that encourages the baby to latch in a somewhat similar way. So having, kind of a wider neck of a bottle can be helpful to encourage the baby to sort of position their mouth in a similar way. But we also need to know that the way that that nipple sort of moves in the baby's mouth once they're latched is not at all how the breast actually works. There's other babies, a lot of sort of full term, otherwise healthy babies. Like I said, they can eat from pretty much any type of bottle and be pretty safe. But there are lots of babies, even full-term babies, who, do some things like choking and coughing and even gagging. Or if we see them doing things like drooling, where we have some milk that comes out of the side of the mouth. But in particular, babies who are born prematurely, and babies with any type of cardiac or respiratory illness or disease, those babies, it is really, really important that we're choosing a bottle that has a safe flow rate. So most of my work is around flow because I think that is the most important part of choosing a bottle in terms of safety. So, the shape and the size can really be important when we look at things like how well they latch, the position of their mouth. But when it comes to safety, it's really flow rate that's the most important.
And you talked about having bottles that are encouraging for babies. I assume you mean having a slower flow rate than what the breast does so that they don't get used to, or what some people may call lazy baby, lazy eater, don't get lazy at the breast, right? We want them to always be having more flow or heavier flow from the breast than we do the bottle.
Yeah. So, when people talk about things like nipple confusion, I really think that that's more of a flow confusion. So, when a baby goes to breast, they have to suck, 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 and wait and be patient until the flow starts, right? And then, breastfeeding, the flow is not necessarily slow the whole time. It actually is pretty variable. So it can actually be quite fast sometimes during the letdown. And then we'll slow down for different periods, and it'll change over the course of a feeding. The difference between that and a bottle is that as soon as they latch onto that bottle, the flow starts going, the milk starts coming. And then it's pretty consistent. It's basically always there and always the same until the milk runs out. And so, when we're doing a combination of breastfeeding and bottle feeding, we want to encourage them to be patient. So that's why, a slower flow encourages them to have a nice, strong latch, and is also sort of encouraging them to be patient. But also, at least in the first several months of life, sucking is reflexive. So if you put a bottle in a baby's mouth and it has a really fast flow and there's a lot of milk in there, they're going to suck and suck and suck, and they're going to suck down that bottle real fast because it's basically just a reflex. And if it's really fast flow, their body doesn't have a chance to kind of tell them to like, wait up, I'm full. So that's why, when for breastfeeding in particular, for families doing a combination of the two, having a slower flow is better for kind of all of those reasons.
And so when we introduce bottles, a lot of parents are worried that it's actually going to disrupt their breastfeeding journey, right? But then there's also that tug that I need a break, and it'd be really nice if my partner could help me. And also it'd be really nice if a postpartum doula could give my baby a bottle so that I could actually get sleep I'm paying for. Like my mother-in-law, my mom, like the big sibling wants to give the baby a bottle. How do we balance the freedom of bottle feeding with also not disrupting our breastfeeding journey?
Yeah, that's a really great question. So, I think initially, because babies have to use their mouths differently at a breast than they do at a bottle, waiting to introduce a bottle until they have kind of established a good latch to the breast can be helpful, just to make sure that they learn that good latch at the breast. At the same time, you're absolutely right. There's a lot that happens in those first few weeks. It is so important that, families moms in particular are getting a little bit of a break, getting some rest. And so, I think the thing about in these early couple of weeks is, there's no right or wrong answer to any of it. And really just being open to what you need. And if you really need a break, then take a break, and it's not going to ruin everything, so yes, absolutely.
One bottle's not going to ruin it for you, you guys. So let's say that we do see some regression in breastfeeding, because it definitely happens. Britt and I are not trying to say that, like breast refusal is not a thing, or that, babies processing is not a thing. So let's talk about that. What do we do? Is the answer to remove the bottle and to kind of give your baby the breast every single time until they get comfortable with that again?
I would say so. Yeah. I think really, if the goal is to continue breastfeeding, then I would say really focus on that first.
Right.
One of the things is also sort of, if baby is doing some refusal, not waiting until they're starving and screaming. And so sort of watching those early cues, sort of maybe offering the breast before they start to get really super hungry, so that they're just a little bit more calm and more likely to sort of be willing to breastfeed. Again, uh, waiting until they're really, really hungry, and then if they are starting to develop a preference, they're going to sort of have that preference towards the easier right away milk flow, right? So yeah, that's what I would say.
It's really hard to feed a pissed off baby, you guys. It's hard to feed them from your boob, but it's also really hard to give them a bottle. A pissed off baby is just a really hard little tiny creature to feed. So, Britt, what kind of cues are we looking for hunger? If crying is the last cue, and that means your baby's kind of now over hungry and they're pissed, what are we looking for as that buildup of like, oh, they might be hungry?
Yeah, so some of the early sort of cues that they're starting to, if they've been sleeping peacefully and now they're starting to move around, you might see, even if their eyes are still closed, doing some sort of rapid eye movements where you can see their eyes kind of moving behind their closed eyelids. Some of the rooting, moving their head around, maybe bringing their hands up to their mouth. Those are all some of the early cues that you would be looking for.
What about sticking their tongue out? I have a lot of people who ask if thrusting their tongue out is a sign, are they hungry?
I mean, it certainly can be. I think babies also do that a lot, just, that's kind
As
of,
a baby.
yes. So it doesn't necessarily mean that they're still hungry. But it can, if, combined with some other things, and combined with, it's been a while since they ate last, it certainly can be.
It's really all about finding the cues from your baby. So every baby's going to have their own different cues. So I think it's really nice for you to know kind of like, what do all the cues mean, and then start to pick up on what your individual baby starts to display when they are hungry. Same thing when they're tired. They're going to have cues when they're tired. They're going to have cues when it's time for them to poop, when they are bored. Your baby is a human, so let's not forget that they are going to have their own personality and their own kind of quirks and characteristics, like we all have too. I know it's so funny to think about our babies as having these adult things, but they do, you guys, they really do. Okay, so Britt, we talked about introducing a bottle and maybe holding off a little bit until breastfeeding is established. Regularly we hear 3 or 4 weeks. Is that also what you kind of typically recommend, as starting to think about it? So what happens if at 3 or 4 weeks breastfeeding is not going well? Do we not introduce a bottle and hold off on that?
So this gets really tricky, right? Because this baby needs to eat. And so, I think you really need to be, if breastfeeding is still not going well, making sure that you're getting the support you need for that. So whether that's working with, some type of lactation support person, and, figuring out if there's something else going on with the baby. Do they have a tongue tie? Do they have, is there something going on sort of GI wise? Are they constipated? Or do they have reflux? Are there things that are contributing to this that we need to be managing? But at the same time, we need to make sure that this baby is fed. And so, that's always a really hard balance. And I think every case is unique. But making sure that you have the support in place to have breastfeeding be, as good as it can be for you and your baby. But then sort of trying to figure out that balance with also making sure that they're getting the nutrition that they need.
Yeah, you guys, this is a great place to like get in touch with a lactation person, an IBCLC, a CLC. If you are a member of the Birth Lounge, we have 20 or 30 videos on lactation. We bring experts in there to talk about lactation. There is support out there, and many insurances will reimburse you for lactation support. Not all of them; it'll be dependent on your insurance, but definitely give that a try. There is support out there for sure. I think one of the things that's really big in lactation support specifically is not waiting until the problem feels so overwhelming that you are just ready to like give up and do something totally different. Don't let it build. When you first start to see problems, go ahead and get some support in there. The quicker that we nip things in the bud, the faster that we can usually get them resolved. Okay, y'all, you know how we're always on the search for clean brands that are going to be transparent with the ingredients and the things that they put in their products? Well, I finally have found one, and I've been using their protein powder for the last 6-7 months, and I have to say, I officially love them. I do. Just Ingredients is slowly becoming my go-to place for so many things that I use in my daily life because I can see exactly what they put in their products, and there's no fillers, there's nothing, that we don't want, nothing undesirable, nothing that I can't pronounce, and I'm like, what is that? They have electrolytes. I mentioned the protein powders. They have magnesium. We know how important that is in pregnancy as well. Fish oil for people who are trying to conceive, and they actually just launched pancake and muffin mix, which I'm going to snag in my next order. And I just ordered bone broth, but I haven't had a chance to try it. Super excited for that. They also have beauty products if you have been looking to switch to a clean and minimal brand. Not only do I love Just Ingredients because they're so transparent, but I love their commitment to using real ingredients and encouraging their consumers to become educated on optimal health and wellness, how they can support their bodies and their minds, and how do you actually understand the products that are in your life and where you might want to swap out different things. I'll never be a gatekeeping girly, and I will always test out products before I share them with you guys because I want to make sure that what I'm recommending is an honest recommendation and you can trust that it will be safe with you and your family. If you want to check out Just Ingredients, go to justingredients.us, so not .com, justingredients.us, and you can use the savings code Tranquility by HeHe, HeHe, Tranquility by HeHe, to save 10% off of your first order. Nothing makes me happier than to help you get healthier, and this is one of the brands that I love and trust, so I wanted to share it with you. All right, bye. All right, Britt. So nipple flows. Can we assume that the bottles that have the venting systems are flowing faster or slower? Does it matter if they look like a boob? The long nipples, are they faster or slower? How do we know as consumers what we're looking at when it comes to nipple flow?
So this has been such an interesting journey for me. I started looking at this when I was doing my PhD, and I wanted to study how babies who had cardiac defects responded to different flow rates of nipples. And so I sort of started asking myself, well, what does slow flow mean? What does standard flow mean? They have these labels on the package, and how do I know that one is different than the other? And so I developed this whole system of being able to test the flow rates of bottle nipples. And it has been truly fascinating in ways I could have never imagined. Because really the labels mean absolutely nothing. I know. There is no regulation whatsoever of sort of what packaging says. So, there's regulation to make sure that there's not like lead in the silicone and things like that. But in terms of flow rates and packaging, none of it actually means anything. So, even within the same brand, two different products that have the same label can have really different flow rates. So for example, the Philips Avent Natural and Philips Avent Anti-Colic bottles, even if they both say 0 months plus, they are drastically different flow rates. At the same time, even within the same brand, two different flow rates can actually be so similar that they're essentially not any different from each of them. So it has been
ploys. This is all just filled with marketing ploys.
Yeah, and I'm not sure that it's a marketing ploy as much as it is really just not having any
standardization.
Exactly. And really not having a way of testing it until I sort of came up with this. And so, some companies now are getting very interested in how their products compare to other company products. And it has now become part of my mission to develop some standardization and develop some standard testing methods. So actually I have some exciting things coming soon this year, where I'm, hoping to advance this area a little bit. But, I think as consumers, it's really hard because you assume that if one brand says, newborn flow or level 1, you would assume that it means something similar to another brand's level 1. And actually that's not at all the case.
And that's super confusing, and that's very unfortunate. So what about the same nipple size within the same brand? So if I buy 6 different size 1s from all Dr. Brown's, can I expect them all to be similar, or is that also going to have different flow rates?
So that is also something that I've looked at, and not always. So there are some brands that are actually very consistent, one nipple to another. I have found, and I don't have any relationship with Dr. Brown's, I'll say that, but I have found that actually their products are pretty consistent. So whereas other brands, if you pick one nipple and look at the exact same, package and everything that it can be a very different flow rate. And, again, this, for a lot of babies, that can be fine. But for our babies who are struggling with feeding, and again, those babies who are born premature, those babies with any cardiac or respiratory disease, those babies often have difficulties with feeding. And when they're learning to feed and learning to feed safely, we really need to be offering them the same circumstances while they're learning. So that is going to help them to know, okay, when I'm eating, I can latch sort of with this strength of my, of course, these aren't sort of conscious thoughts that they're having, but
Sure.
but it's a learning process. They're developing all those connections in their brain to tell them, okay, I latch like this, I can suck this many times and then I need to swallow. I can coordinate my breathing and my sucking and my swallowing in a way that keeps me safe. If we're changing up the flow rate every feeding, even if we think we're using the same nipple, but because it's not very consistent, it's different from one feed to another, they're constantly having to adjust all of those things. And so it makes it more difficult for them to learn how to eat.
Yeah, that inconsistency must be really hard. I mean, so many adults struggle with inconsistency. So being a newborn, having to learn kind of a new skill, because, guys, breastfeeding is a learned skill. Yes, your baby knows how to do it, but they have to learn how to do it. written in their DNA, but they don't come here ever having done it before. It's really a brand new skill. That must be super hard. So are there brands and nipples that are better than others for, I'm not going to say for all babies or like for all families, but maybe babies who are specifically struggling and or have one of the factors that you've been mentioning that may impact feeding?
Yeah, so the Philips Advent natural nipples, I have found that those are really quite slow. Interestingly, they actually just changed their product and now have what's called a responsive nipple. And I have them and I haven't tested them yet, but I will be doing that soon. So actually, if people are interested, and I'll share my website at the end, but I'll be sort of alerting people to those findings as soon as I'm done with that testing. Some of the other, so Dr. Brown's Preemie, that is available to people, you can purchase that pretty much anywhere. That is pretty slow and pretty consistent. The Komotomo slow flow it's on sort of the faster side of slow, but it's sort of still in that group of nipples that's on the slower side. There's also like the Playtex Ventair, and there's a newer company called Infant, NFANT. They have a couple of nipples now that they sell. They were available on Amazon at one point, but I'm not sure if that's the case anymore. But they have some nipples that are on the slower end. So those are kind of the ones that, if I'm working with a baby who's really struggling, those are the products that I would go towards.
That's really good to know that you have options. So quick question about the preemie. Are preemie and size 0, are they the same, or is it worth distinguishing between the two?
Oh, it's so interesting. No, preemie and 0 are not always the same. Actually, in some cases, so, when babies are in the hospital, oftentimes they're offered some of the disposable nipple products. And so in some cases, those disposable products have a preemie label on them, but they're actually faster than the standard flow, which has also been really interesting to learn and share with people in the hospital, because it's just not at all what we would have expected. So those companies are starting to make some changes now, mostly based on my work and letting them know. But, so no, preemie doesn't always mean what you think it's going to mean. And we really need data to guide those decisions if we have a baby who's really struggling.
I'm so honored to be in the presence of such a shaker upper. I love it. I love it so much. So that is fascinating to me that in the hospital, we're offering nipples that actually may be hurting breastfeeding relationships, because if they're actually faster than what that parent's milk is, and in the beginning it's colostrum, so it's actually not going to even be able to compete at all with a bottle. That's actually pretty harmful. That's sad.
Yeah, absolutely. In the ready to feed bottles that come in 3 ounces, in the early days of breastfeeding, your baby's stomach is so small. But again, their sucking is reflexive. So like I said, if you put that really fast disposable nipple on a 3-ounce bottle, they might suck that whole thing down. And it's not because they need it, it's because it's reflexive. And then they actually might spit it up because their stomach's really just not big enough to handle that. So, things that people can do, and actually, interestingly, those disposable products are often faster than what's even available kind of in general places that we might shop for baby things. So in some cases, like bringing your own bottle and nipple system, especially if you've done some work to look at like what is fast or slow, and choosing something that's slower, bringing it, to the hospital with you. Again, if you're planning to do some bottle feeding, starting them off with a bottle that you're going to give them and that they can learn from. Every feeding is a learning opportunity, whether it's a breast or bottle. And so really encouraging every feeding to be as positive and as good of a learning experience as it can be.
Absolutely. Oh my gosh. This conversation has just blown my mind. I thought you were like, what?
Yeah.
So, Britt, I have a question about some of the factors that may lead to having difficulties feeding. We've had a couple children in our community specifically that have Down syndrome. Would that be something that might impact feeding that we really want to be aware of the nipple flow?
Absolutely. Yeah. So babies with Down syndrome tend to be a little bit hypotonic, meaning they don't have quite the same sort of muscle tone. And so, those babies often do struggle with feeding. And they are babies that we want to, again, make sure that every feeding is a positive learning experience. And so, one of the things about flow too is that when flow is really fast, babies can sort of create this really weak latch to the bottle. And so they don't really have to work too hard. Sometimes they can even like munch on the nipple and the milk will just come out for them. So those babies who are having a little bit of difficulty, or babies with Down syndrome who might be sort of naturally have a little bit lower tone, we want to slow down the flow and encourage them to create a really nice, strong latch. That's going to help them create that musculature in their mouth that then becomes really important for things like speech later on. So we don't want them to be creating that really weak, sort of loose latch that, you can move the bottle in and out really easily. We want to be seeing that they have a nice, strong latch, and that is encouraging their muscles to build up.
That'll play a role too in introducing solids. I mean, we need our babies to have really strong jaw muscles to introduce solids, and we want their gag reflex to be at a place where it can actually kind of tell the difference between liquids and solids.
Absolutely. Absolutely. And so, that musculature and all of those muscles, they have to really create a latch that their tongue has to be involved and be really, creating that strong latch. And then that tongue musculature becomes really important for managing solids when that happens. So absolutely, there's a lot of things that go into this that become really important later on down the line as well.
Yeah. So one of my last questions is we have tons of people who ask this, and I really don't know where they get it. It always baffles me when we get this question. I think only because I would never think to do this. Is there any reason that we would need to take a bottle nipple and compare it to our breast to see if they are similar? So if I have short nipples, am I trying to have a bottle nipple that also has a short nipple? If I have longer nipples, am I trying to have a bottle that has a longer nipple? Does that matter at all?
Like I said earlier, the way that the breast moves within the baby's mouth when they are breastfeeding, even nipples that might appear short or appear long when baby's not latched on, that nipple really moves into the baby's mouth and then moves pretty far back into in their throat. And a bottle is just not going to do that. The way that the silicone or the plastic works, it's not going to move in that same way. So, there's certainly some babies latch better to different shapes and sizes of bottles. But I personally don't think that we need to be worrying too much about whether they look like the breast. I think they just function so differently that that's not that important.
Yeah, they're just different tools, right? So we're never going to replace the breast with a bottle. And I think that's where a lot of people get hung up. They're not going to be interchangeable like that. Your baby's never going to confuse your warm, fleshy nipple with a silicone nipple. They may have a preference, but they're never going to be confused on that.
Yeah, if they appear confused at all, it's usually just, like you said, developing a preference that tends to be more about flow rate than about the shape or size.
It's their first dose of personality.
Oh, yeah.
Get used to it. Okay, so Britt, before we wrap up, is there anything else that you'd like to leave our community with, or anything that we didn't chat about that you think is very important for people in particular to know about flow rates or nipples before they choose a bottle?
Yeah, I think we covered a lot of the most important stuff. So if you're interested in this and want to learn more, I will be sharing more through my newsletter. So if you want to come to my website, it's www.infantfeedingcare.com. You can sign up for the newsletter, and I'll be sharing some important information coming out pretty soon, including, like I said, the new flow rate of the new Avent product. If you're in Massachusetts and your baby is struggling, or you're close enough that you can come to Massachusetts and need help, I am seeing patients clinically for both breastfeeding and bottle feeding support. So that information is available through my website as well.
That's awesome. Britt has some amazing data, you guys. We send our people to Britt to take care of all of their lactation stuff. And they all come out fixed up better than when we sent them in. So she gets our seal of approval on this end. So Britt, thank you so much for this conversation. This was great, from flow rates to complications that can happen, to how do we distinguish between the marketing, to when do we introduce a bottle, to what do I do if my baby decides they don't like my boob anymore. This has just been a conversation that is going to change so many lives. I'm so grateful that you joined us today. Thank you so much.
Thank you for having me.
I appreciate it.
Thank you so much for tuning in today. I love hanging out with you, and it is an honor to be your go-to gal when it comes to preparing for your baby. If you've enjoyed today's episode, please leave a 5-star review and tell others why they should be listening to the Birth Lounge podcast too. You deserve to have a birth that you love with a provider that values your autonomy and respects informed consent without all the trauma that you so commonly hear about on social media. New episodes air every Wednesday and Friday. Hit that follow button so you never miss an episode. I'm HeHe, and this is the Birth Lounge Podcast.